One of the questions that we get a lot is, why do I have to come back every 3 months or every 6 months for cleanings? And this really goes back to the concept of periodontal disease being a disease that we never use the word cure, we use the word arrest. The bacteria that cause periodontal disease, we know that they live in the mouth, they certainly live around the gums, but they also live in the back third of our tongue where we can't get back and get them clean. So the potential of periodontal disease coming back again is high if you didn't take care of them. Now, as human beings, we'd all like to think that we're 100% every time we pick up a brush or floss. But even in my own mouth, the hygienist loves to find areas that, hey, you missed over here. It's just part of our human nature. So what the whole purpose is, over the years, 3 months seems to be the time period that a patient can do an average job. And by coming in every 3 months, we can pick up the difference of where they may have missed or not been doing it, and it hasn't gotten out of hand. Every week I have someone that comes back in that I haven't seen in 4, 5, 6, 10 years, and they've got some deep pockets. And as I said before, they started somewhere. They started with a 4 and a 5, and it went to a 7. Now all of a sudden they're coming in at a 10, and that's a shame because they didn't have to. Patients that I've been watching for years, and I'll look at their chart, and I'll see that over a 10, 20, 30, 40-year period, that they've maintained themselves. They come in regularly. Now they miss once in a while, but they basically come in on an alternating 3 month, which is, I think, the safest thing for the patient. They see a periodontist at 3 months, then see their general dentist at 3 months. Our emphasis, of course, is the gums and periodontal disease. Their emphasis is the fillings and the restorative aspect. And we cross-check each other. They may notice something and send a report. So in the long run, the patient really gets the best of both worlds, even though most patients don't like to have to go back and forth. They'd like to just stay in one place. But sometimes I don't think they realize the benefit of someone else looking over, and I encourage it. I think it's great because sometimes you may not see something that someone else may pick up. But in the long run, coming in on recalls is really what helps the patient. That's part of the concern I have today, because what's happening, because of the economy, one of the places patients are trying to save money, and certainly we understand that, is to cut back on their 3-month recalls so that they are now coming in every 6 months, or they'll skip one and whatnot. And my concern is, yeah, we're going to get away with it for a short period of time, but we're not going to get away with it over a long period of time. It's going to come back, and the patient's going to end up spending more money having to have something else done. Advanced periodontal disease, because of how fast it can move, generally the ADA likes us to take full mouth x-rays every 7 years, and periodontists generally try to go every 5 years. And if you sat in my shoes and saw these x-rays on a regular basis, it's amazing how much you can pick up. So I encourage patients to stick with it. We just put in a whole new system at the office. The radiation nowadays is a lot less than it ever has been before. In fact, when I hear the buzzer clicking, it's almost, I can't even hear the duration. It's like click, where it used to be click, as the radiation is going through. So I'm not saying it isn't important to be aware of it, but at the same time, it makes sense to stay ahead of the whole thing rather than letting it catch you off guard.